Hello, Anthea. How lovely to see you. And
Hello,
thank you
Gail.
very much for agreeing to tell us your story and talk us through it. That would be fantastic.
Well, I was actually diagnosed back in 2009, so 11 years ago, and it was on a blood test for another reason. In fact, I'd had it 2 years before because I had a blood test where my lymphocytes were slightly raised, and should have been repeated 6 months later, but I just wasn't told about it. I went to see the GP, and he said, "You've got CLL." And I was a GP for many years myself, but I couldn't think for a minute what on earth CLL was. My brain just wouldn't get into gear. And he then said the classic, this is something you'll die with, not from. It was not helpful. It was not what I needed to hear at that time. And I'm afraid when I was on the other side, I remember saying that to a couple of patients I had with CLL. But, doctors aren't always very good at, sussing out the right way to talk to patients.
Yeah, we do hear that a lot, where a lot of people are told, you've got CLL, here's a leaflet if they're lucky, and then off you go. So then what happened? Did you go on to watch and wait, or did you have treatment immediately?
I did about 2.5, 3 years on watch and wait. I had 11q deletion, and so I was told from the outset that I'd need treatment sooner rather than later.
Did they do a FISH test straight away then?
I did, yes. There was a delay trying to get an appointment locally, and I was able to be seen at Bart's, which was very, very fortunate, and so they did FISH straight away. And in fact, I put treatment off as long as I could. I was actually scared of having chemo because I was living on my own. Yes. I didn't know how I would manage.
So what treatment did you have? What was your first line treatment?
I went into a trial. It was lenalidomide.
Right.
Versus chlorambucil. But in fact, the trial was pulled. I was only on it for about 6 months.
Right.
Because there was excess mortality in the treatment arm. And I then managed to stay off treatment for another couple of years.
So you're still at Bart's at this point?
Yes.
And Bart's then decided you did need treatment again. So you've now done watch and wait plus a small level of drugs for about 6 months, and then you went into your second line treatment.
We got to about 2014, about 6 years ago by then.
Right.
And I was fortunate enough to be able to have Ibrutinib. And the reason for that was because it was counted as a second line drug. Yep. And so I had it on the compassionate care basis. And it worked really well. My white count came right down. I did develop autoimmune hemolytic anemia while I was on it.
Was that related to the Ibrutinib, or was that something separate?
Well, it's a complication, it's a recognised complication of CLL.
Right.
But I think that if you're on Ibrutinib, it may increase the incidence. But anyway, I've continued to have it since, I was on Ibrutinib for a couple of years, and I've had further episodes since I stopped it.
So you stopped the Ibrutinib after 2.5 years, something like that?
Yes, and that was because I developed a peripheral neuropathy. I was seeing Dr. Agrawal at Bart's, and he gave me the choice to continue to have a break or stop the Ibrutinib. So I stopped it and didn't restart again.
Right.
After I'd stopped it, for I think nearly 2 years, I was really well.
Fabulous.
And then I went down really pretty acutely. I had a bad go of hemolyzing.
Could I ask you to explain hemolyzing?
Hemolytic anemia is a process whereby you actually destroy your own red blood cells. And when it's autoimmune, this is because you're actually producing antibodies yourself against the red cells. And the standard treatment tends to be high-dose steroids. So I had rather a lot of steroids.
Dr. Agarwal decided that you needed treatment. And then what was your third treatment?
I was eligible for Venetoclax.
Right.
And I started that just over 2 years ago as monotherapy, which was standard, for the compassionate care program.
Mm-hmm.
And I'm still on that now.
And so what's your situation now? Are you on any drugs at all at the moment?
I'm on a lot of drugs.
Yes.
I'm very well. The Venetoclax knocked my neutrophils. So I have GCSF twice weekly, which I inject at home. And I've been on prophylactic antibiotics for a long time. So I have azithromycin now 3 times a week. Last year, things did get bad actually, because I had a series of nasty viral infections, and I was in hospital. I think 4 or 5 times last year.
Oh.
And by last September, I had a bad one, and there was a radiological pneumonia, which took quite a long time to settle. So I finally satisfied the criteria to start intravenous immunoglobulin, IVIG. And to start with, it was monthly, intravenously, which meant a trip, obviously, to the hospital. And it carried on right through the lockdown. I was obviously very anxious about going, but the department was virtually empty. They'd gone through all the patients case by case and only continued with those they thought it was really essential. Well, I think I'm very lucky because I have shared care now with my local hematology department alongside Bart's. And, I think actually, I actually was pretty ill last year.
Right.
It's one of those things, when you get ill, illness is quite kind because you have to sort of give yourself up to it. When you land up in hospital, and so I was rather protected from realizing how ill I was. So I think it wasn't so much luck as that
you deserved it. You deserved the treatment.
There would have been a real risk. They said this to me. The risk of me getting another infection and having to be admitted and then picking up COVID. But anyway, I was converted about 4 months ago to subcutaneous immunoglobulin. I now have it weekly at home, which I have as an infusion into my abdomen. And that's, it's a fiddle learning how to do it, but it suits me down to the ground because I can do it when I want to.
And tell me about your neutrophils, because you said the Venetoclax has made you slightly neutropenic.
They're fine, but only with having twice weekly GCSF.
And you don't need to follow a neutropenic diet or anything like that.
I'm constitutionally, I would say, a bit of a risk taker. But you do your own risk assessments all the time on everything you do. And my neutrophils have never been below 0.5. And so I really eat everything.
Yeah.
The only exception now, and I did ask about this, is I don't eat anything with mold on the top. There's a time when I would have taken mold off, things like yogurt and jam, but yes. I don't do that.
No, we must say to everybody watching, please don't eat anything with mold on. That's
the other thing, I've got a dog. I had a new puppy last year, which was again quite a risk, but I was encouraged to do it by my consultants. And I like gardening. And yes, and there's the question of dog poo.
Yes.
And you know, I have to pick it up. I mean, there's nobody else to do it. But you know, I'm careful.
For you, Anthea. She's a great therapy for you.
She yes. I mean, the things that she does for me,
yes,
far outweigh any risk.
Oh, so to recap, you've been through a huge array of treatments over the years, come out smiling the other end, and look fabulous. Obviously, you have a great life with your dog and your home and your children and everything. And you're an advocate, I would guess, unless you're going to tell me I'm completely wrong, for just getting on with it, taking the drugs, doing the stuff, listening to your consultant, and then getting on with life.
Absolutely. I mean, I've just had my 73rd birthday. And when I had my 70th birthday, you know, I actually said, you know, I've had my biblical 70 years and 10, and every year on top of this is a bonus. You know, I mean, you know, if this had been 20, 30 years ago, I doubt I'd be here now. I do live life to the full. I mean, when we finish this interview, I've got my 2 little grandchildren coming, aged 6 and 4.
Lucky you.
And until the lockdown, you know, one or other of them was coming to stay every 3rd weekend. And that's been a huge loss. But now I'm back to having them. You know, I mean, just suppose I had an infection. It doesn't have to be COVID. Suppose something, you know, really happened and things went pear-shaped and I died. Then it would be so sad that they hadn't had time with me later on. So I'm prepared to take that risk.
Everybody should do their own risk assessment and with their consultant and with their CNS and that sort of thing. And
Absolutely.
And it's very inspirational to hear your story. And I hope as well it's inspirational for people recently diagnosed, because you've taken advantage of the drugs that have come on board, Ibrutinib, Venetoclax. And for people going forward, there'll be newer drugs. And I hope people watching you can see the force for good that all this has been, and how fabulous now and how lovely to have just celebrated your 73rd birthday, and happy birthday.
Well, thank you, Gail. I mean, I think if I could just say in conclusion, I mean, I think throughout this whole process, I've always thought, I've never said, why me? Why did I get this? I've actually said, why not? Somebody's got to get it. And I think the other thing that has helped is that language has changed about chronic illness and even potentially life-limiting illness. And so instead of talking about suffering with an illness, which just implies pain, now it's living with CLL or any other illness, and that is different. And I think, quite honestly, CLL has changed me, and I think it's actually changed me for the better. I'm a lot less critical of other people. I'm a lot more accepting of things. When I see people getting uptight about small things, I think, well, you just don't need to, you know, and, you know, life is here and it's for living. And
our sort of motto is living well with CLL, which I think is something that you do exceptionally well. And thank you again. It's been brilliant.
Well,
thanks.
Thank you very finally to the consultant. I mean, Dr. Agrawal at Arts, you know, who's been with me right through this journey, and the local team, and I mean specialist nurses. You know, because I couldn't do it without them.
Well, you're lucky. Dr. Agrawal is speaking next, so I'm just hoping he's listening. Fantastic, Anthea. Take care and see you soon.
Thank you very much.
Bye-bye.
Bye-bye. Bye-bye.